At the outset, whenever I mention COVID-19 and vaccination and vaccine together, that's simply because I'm quoting either a person, an individual, or a study. Personally, I like to use the language pharmaceutical cocktail and pharmaceutical intervention. Now, are you a bad driver, reckless, sort of like Mad Max? Well, not to worry. Looks like the experts have cooked up a novel theory that might explain it. Simply put, it's because you didn't take the COVID pharmaceutical interventions. That's it. Sounds crazy. You mean like men can menstruate? Yeah, exactly. According to a government-funded study released in December, your risk of getting into a traffic crash is significantly higher if you're hesitant to get the pharmaceutical cocktails against COVID-19. Vaccine hesitancy is a reflection of psychology that might also contribute to traffic safety, it says, concluding that an awareness of these risks might help to encourage more COVID-19 vaccination. Did you catch it? The key word, might. Given that level of confidence, almost makes you want to roll up your sleeve and, almost. The underlying premise of the study is that vaccination uptake has stalled despite being safe, effective, and free. Safe, effective, and free. Now they tell me. The study was financed by government entities, aka you and me, but none of what one of them said a link was not evident between the study and the encouraging vaccine confidence federal program, despite the lead author's participation in the study. The study was led by Dr. Donald A. Rettelmeyer at the Sunnybrook Research Institute and published in the American Journal of Medicine on December 2nd. Physicians counseling patients who declined COVID-19 vaccination could consider safety reminders so their patients do not become traffic statistics, said Rettelmeyer in a December 12th statement from Sunnybrook announcing the study. Research was conducted with data from the province of Ontario and included individuals that were 18 and older as of July 31st, 2021. During the month that followed, the study says that 6,682 individuals required emergency care following a traffic crash. The month that followed. Well, that's certainly a long-term study, huh? Unvaccinated individuals made up 25% of total crashes for an absolute risk of 912 per million, whereas those vaccinated had an absolute risk of 530 per million. Now, class, if we focus on the difference between the absolute risk, that's 382 per million for the unvaccinated. However, is that number higher or lower than the risk of potential adverse events from the pharmaceutical cocktails per million? Divided along age groups, the data shows the relative risk of a serious traffic crash was higher for the individuals that opted for the cocktails and were in the category of 65 and older. So that would mean those that passed on the cocktails in this age group were at lower risk? Kind of counter to the study's headline, no? The study's authors explained the reason for this being that this is the more vaccinated age group who would typically be on the roads less due to being outside the workforce. Not sure how that explains it, but hey, they're the experts. The lack of data on driving exposure of the different groups was cited as a study limitation. So the study had some limitations. Okay. The author said, citing a previous study from Rettelmeyer, that 100% increase in driving distance is unlikely to explain the magnitude of traffic risks observed in the study. Passengers involved in crashes, whose impact on the circumstances is unknown, were also counted in the study, as were pedestrians. So, both unvaccinated groups were shown to also be at a higher risk of an accident if they were passengers or pedestrians. So basically, if you've passed on Big Pharma's cocktails, don't be a co-pilot or cross the street. Got it? Another limitation identified is that correlation does not mean causality, without the causes of vaccine hesitancy or risky driving being explored. Oh, you mean like the entire premise of this study then? However, the study says that distrust of government or belief in freedom is one possibility explaining both vaccination preferences and increased involvement in car crashes. Distrust of government and belief in bodily autonomy. Those right-wing conspiracy theorists, how dare they believe such crazy ideas? The author said the findings could justify insurance companies raising premiums for the unvaccinated. That's the money line, folks. Come on, insurance companies. You gotta charge more to these science deniers. Together, the findings suggest that unvaccinated adults need to be careful indoors with other people and outside with surrounding traffic. Wouldn't that kind of like apply to everyone? The Epoch Times reported that several questions sent to Dr. Rettelmeier were left unanswered, including whether he could share the underlying data and what was the rationale to include passengers. Let's hope the good doctor wasn't met with a sudden and unexplained accident, and not the traffic kind either. The Epoch Times also asked for a clarification on the conclusion, which suggests that if an individual was hesitant up to a certain point, and during that time of hesitancy, he was more of a danger to himself and others on the road, once he accepts the cocktails, his psychology would change to the point of starting to respect rules of the road more closely? Well, looks like that may be another side benefit of the cocktails. Safer driving. Who knew? Entities funding. I'll mention. The study received funding from various government entities, aka taxpayers, and it is being reported on after recently receiving statements from some other parties. Entities funding the studies were identified as the Canada Research Chair in Medical Decision Sciences, the Canadian Institute of Health Research, the Graduate Diploma in Health Research at the University of Toronto, and the National Science and Engineering Research Council of Canada. Too bad these folks couldn't have diverted some of those funds to figuring out what's happening to all of our Canadian doctors lately, huh? CIHR spokesperson David Coulombeau said Rettelmeier is funded by a 7-year, $1.4 million grant from CIHR through the Canada Research Chairs program. Rettelmeier and Sunnybrook also received $50,000 from the Encouraging Vaccine Confidence in Canada Promo Science grants with an agreement date of July 1st, 2021 to June 30th, 2022. Promo Science. Promoting science. This funding program, which seeks to deliver evidence-based vaccine promoting information to key communities, is managed jointly by the NSERC, the CIHR, and the Social Sciences and Humanities Research Council. No wonder we have such large deficits. NSERC spokesman Martin Lacroix told the Epoch Times the grant applications are peer-reviewed by experts, but are not to be released to the public. Well, that's good enough for me. Peer-reviewed by the experts, folks. All applications and subsequent communication between NSERC and applicants are confidential, he says, unlike your vaccination status, of course. He also said there does not appear to be a link between the traffic study and the NSERC VCC, the Vaccine Conference in Canada grant, but that it is likely that one or more of the study authors has benefited from the NSERC support, either directly or as a student through an NSERC grant to the supervisor. Okay, so in non-expert talk, does not appear to be a link unless you consider getting support, aka cash, a link. Okay, yeah, totally makes sense. Over $2.4 million has been dispersed to researchers under the Encouraging Vaccine Confidence in Canada program, according to available data online, with most for an amount around $50,000. Only if they spent so much money on encouraging critical thinking. Imagine where we'd be, folks. You'll be happy to know that as a taxpayer, you've funded similar research done under different programs, such as COVID-19 Vaccine Confidence, as well as the one I reported last week, the one where the Public Health Agency of Canada has hired a social media intelligence collection company to obtain large amounts of data on the unvaccinated in order to better target them with pro-vaccination messaging. In other words, propaganda. Makes you wish they would stick to doing what they know best in Ottawa, huh? Nothing. Anyway, Thanks for watching. I do appreciate it. Please post any comments you have in the comment section. You can also follow me on my Rumble, on my locals, and please subscribe to my Rumble's account because you know what? Sometimes YouTube considers me reckless in what I post, and next you know, I'm off the road in a ditch. Anyway, we'll check out some of my other past videos, and as always, like I said, I welcome your comments and thoughts. Please post them, and I will see you next time.